Good morning. How are you?
I'm good.
Hi, my name's Sue.
Nice to meet you. I'm Marjorie.
Hello, Marjorie. Welcome to the Coumadin Clinic.
Okay.
So your doctor put you on Coumadin. Okay. Do you know what Coumadin is?
Not exactly.
Okay. Coumadin is an anticoagulant and it thins the blood. And your doctor put you on this medication because he diagnosed you with AFib. Now, because your AFib, your atrium is not contracting properly, and that predisposes you to a blood clot. The medication that you're going to be on has some important information that I'd like to give you. Here's a little packet here that you can take home with you and read over. I'm going to highlight and go over some main points for you to understand, and if you have any questions, you can ask me. So you're going to come visit us at the Coumadin Clinic at least once a week in the beginning, and what we'll do is a little lab test while you're here. It's a little finger stick, and we'll draw some blood, and that'll give us an INR level, and an INR level is a bleeding time, and it'll let us know how fast or slow that your blood is clotting.
Okay.
And now based on that level, we'll prescribe to you a certain milligram of Coumadin, an amount of Coumadin that you'll be taking. And it's going to vary in the beginning depending on how fast or how slow we can get your blood therapeutic. Now there are a couple factors into getting therapeutic while you're on Coumadin, and one of those is the foods that you eat. There are certain foods that are high in vitamin K, and vitamin K is found in dark green leafy vegetables and some fruits, and I do have a list here for you. Now this doesn't mean that you can't eat any vitamin K rich foods. It just means that the foods that you eat have to be eaten consistently. For instance, if you like to have a salad with some spinach or green leafy vegetables in it every single night, that's fine, but as long as you keep that consistent, you have that same amount each week. Because if you eat a whole lot one week and then don't eat any the next week at all, that can kind of throw your levels off a little bit, okay? The list goes down and it shows you like your high vitamin K foods, for instance, are broccoli and Brussels sprouts. Just kind of remember your dark and your leafy vegetables, and then all the way to the bottom here you can see that there are some foods that are, vitamin K free, like fish and eggs that don't have any vitamin K in there. You can always refer to that sheet, okay? Some important factors that you want to remember while being on Coumadin: you are also predisposed to bleeding a lot easier. That means if you fall and cut yourself, when you shave you need to use an electric razor, when you brush your teeth you may see a little bit of blood, you may want to just use a soft bristle toothbrush from now on. You need to take your Coumadin every day around the same time. You need to make sure you come into your appointments with us so that we can draw your blood and get you therapeutic. You need to tell your doctor if you're having any bleeding problems. You need to make sure that you let your dentist know if you go in for any procedures, dental cleanings, any outpatient procedures. Make sure you let the doctor know if you cut yourself and you're not, your blood's not coagulating fast enough, or that you're bleeding too much. Don't forget to take a dose. Don't double up on a dose either. If you forget one day, give us a call and let us know. Don't take 2 doses in one day or something like that. And also know that Coumadin and warfarin are the same drug. One is a brand name and one is a generic name. Okay? Do you have any questions about the Coumadin?
No. How often?
Well, in the beginning you'll come about once a week, and we'll draw your blood, and just depending on your levels, every time that you come back will depend on how fast or how slow that your blood clots. And sometimes, and it depends, it varies for different people. Sometimes you'll come more often, and sometimes, maybe once a month once we get you to a therapeutic level.
That'd be nice.
And also another important fact that I forgot to tell you though are over-the-counter medications. There are certain medications that interact with the Coumadin. Listed here are garlic, ginkgo biloba, St. John's wort, vitamin E. Anything with vitamin K, you need to watch your multivitamins. Make sure you refer back to your physician for anything over-the-counter like that. Don't take aspirin unless he specifically tells you to.
This is why we clock. 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 This is why we clock.